is a good one. I like this one. How long should you keep a breast expander in? How long should you keep a breast expander in before exchange? Is there a time scale? And can it cause problems if kept in too long? Thanks. So what this is referring to is a breast expander. A breast expander is an implant that you put into the breast and you blow it up. So it has a reservoir which you can fill with fluid, and it usually has pretty much always has a port, and the port is usually a remote port. So it's a little tube and a little button that you can feel under the skin, a bit like a gastric band, that you can put a needle in. It's got a self-sealing valve that you put a needle in and blow it up, or it's got an integral port, which is on the expander where you use a magnet and you locate it and you put a needle in, a similar sort of concept. It's a sort of membrane that you can put a needle in, and when you take the needle out, it seals itself, so you can blow it up. And it's usually used in breast reconstruction. So it's usually used in breast reconstruction because there's a lack of skin, and it's for a delayed breast reconstruction. So someone who's had a mastectomy, who has had the skin all removed and it had the breast removed, and so they've got no breast, and you want to create a breast. And if you want to create it with an implant, what you can do is, obviously you can't put a fully sized implant in underneath the skin because it'd be too tight. So you put an expandable implant in, you put it in flat, you blow it up a little bit, stretch the skin, leave it for a few months, then blow it up a bit more, and you gradually blow it up to stretch the skin. Now there's two types of expander. There's a tissue expander, and there's an expandable prosthesis. So that's the first question that I'd have. So a tissue expander is literally an empty bag that you blow up. An expandable prosthesis is an implant. It's got silicone shell and a silicone gel like an implant has, but it's got a central reservoir that you can expand to make it bigger. So a tissue expander is always a temporary thing. It's a thing that's just an empty bag that's used to stretch the skin. Whereas an expandable prosthesis can be left forever. It can be, you blow it up to the appropriate volume and then you can leave it forever. You don't have to remove it. So that's number one, is an expandable prosthesis or a tissue expander. So let's just assume it's a tissue expander, because if it's expandable prosthesis, as I say, you can leave it forever. If it's a tissue expander, and again, you say you still have these in the breast, you have to leave it for a few months in order to let that skin sort of accommodate to the stretched level, and then you would exchange it for a definitive prosthesis. Now, the question is how long, what was the question? How long should you keep an expander? So I would say 3 months would be normal to leave the expander once it's up to full volume before exchanging it for the definitive implant. Is there a time scale? Can it cause problems if kept in too long? No, it can't cause problems if it's kept in too long. The only problem with it is they're not built to stay in forever. They don't have much shape, and it often doesn't look very good. A tissue expander, they're often quite just sort of round, and they don't look very good. Whereas if you exchange it for an implant, again, if you're doing this for reconstruction, which I'm assuming it's for reconstruction, I could be wrong, but I'm assuming it's for reconstruction. So when we do breast reconstruction, we pretty much always use teardrop shaped implants because they have the shape of a breast, whereas a tissue expander will be just a round thing, which is just generally stretching the skin. So you'd probably want to have it changed because the shape will be better with a definitive implant, and you won't have the port as well. But you don't have to have it changed. There's no problems with keeping it in too long. So in answer to your question, is there a problem leaving it too long? No, there's no problems leaving it in too long, but it's just not designed to stay in for a long time. They're designed just as a temporary skin stretching device. So I wouldn't know why you'd have it in too long, but unless there's a reason, if you got ill or something and couldn't have it changed, then I'm sure that's fine to leave it in a bit longer.